How do I get a higher VA rating for hearing loss or tinnitus? Unfortunately, the VA doesn't give very high rating. For hearing loss, they do go from 0 to 100%, but most of the time they prescribe you hearing aids, which solves your hearing problem, and you get a 0% rating. So 0% is common. As far as tinnitus is concerned, 10% rating is all you get. There's only one rating available. You either have it and you're rated at 10% or you don't. Doesn't matter which ear it's in or in both ears, 10%. So this sucks, right? You get out when you're 22 and you have tinnitus and or hearing loss or both, right? And all you get is a 0 or 10% rating for each of them. And you're going to be dealing with this for the rest of your life. This isn't fair, and the system's not meant to be fair. The system's the system, and we need to find ways to work around the system, within the system, play the rules of the game. The way we do this is we file secondary VA claims to hearing loss or secondary VA claims to tinnitus. This is where the strategy comes in. You want strategy tips? Check out my bootcamp, links in the description. Let's check out the first example here. Depression or somatic symptom disorder secondary to tinnitus. So we have a 10% rating for tinnitus, and then there's this little arrow here, which means secondary. This is a 70% mental health rating. Makes sense, right? This is logical. If you're young or any age, and you have severe tinnitus ringing in your ears like your entire life, or you have hearing loss and you have to wear hearing aids, like that's depressing, right? That's logical. It makes sense. This is a claim that is winnable. It's won all the time if it's done properly. Again, check out my bootcamp. This is strategy stuff. You need to have some kind of strategy and you need to have some kind of game plan. But this is an easy way to turn a 0% rating for hearing loss or a 10% rating for tinnitus into 70 or 80%. Now let's hop over to hearing loss. Here's a 30% rating for hearing loss, which is a very high rating in my opinion. Then we have the little secondary arrow here for 50%, somatic symptom disorder with depressive and anxious features. So we have 30% for hearing loss, and then this little arrow here, this is the secondary arrow for 50%, somatic symptom disorder with depressive and anxious features. So this is a 30% rating with a secondary hooked onto it for 50. The burden of proof is on the veteran. These are logical things. I'm showing you the ratings. How do you actually make these stick? How do you make secondary stick? You need to have your doctor call out the nexus. So you need a current diagnosis of a mental health condition. You only need one, by the way. Somatic symptom disorder works, depression works, generalized anxiety disorder. It's not about how many diagnoses you have. It's all about your levels of social and occupational impairment. It's hard to wrap your head around this a little bit, but once you get it, you just focus on how much this affects your work and your social life, and that's where the higher ratings come from. You're going to need a medical doctor to diagnose you. You may know you have depression, may know what it feels like, talk to other people. You need an actual diagnosis from a doctor. So this is a psychologist or a psychiatrist, board certified. In addition to that, you should have him fill out an independent medical opinion, or better yet, the mental health DBQ, because that's what you're going up against in your C&P exam. Have the boxes checked. C&P examiner does the same thing. You're on the same page with the burden of proof standard. And then the nexus is the link. So this is how the nexus works. So especially with secondary. So you have hearing loss, and it causes you depression. You may just realize that it causes you depression. You may have been out for 10 or 15 years. You may have other things in your body causing you depression, You may have cancer or a bum foot or a broken leg or migraines or a million other things. You're only service connected for hearing loss or tinnitus, so your doctor needs to be specific. Your doctor needs to write the nexus, and it needs to be on an at least as likely as not basis. So what does that mean? That means there's a 50-50 chance. So your doctor that you're paying to do the nexus, unless you could get one to do it for free, good luck. I hope you can find one. If you can't, check out my med team. They can help you out for sure. So they need to say it's at least as likely as not. This is a burden of proof that's a 50-50 chance. So can it be because you have cancer? Can it be because you have plantar fasciitis? Can it be because migraines? It could be all those things, but if they're not service connected, your doctor's not going to want to talk about things that are not service connected because secondaries need to be filed secondary to something that's service connected. Tinnitus and hearing loss are the most common claims, so that's what I'm using here. Here's the examples. Let's take a closer look at this burden of proof, at least as likely as not. It's a 50-50 chance. So you have is due to, which is a 100% chance. More likely than not, 80% chance. At least as likely as not, 50% chance. If your doctor writes any of those three things, you're good. Your nexus is solid. Now, here's the two that don't work in your favor. Less likely than not, that's a bad nexus, and that's what C&P examiners typically write, and then is not due to. So get used to this language, wrap your head around it, and then compare it to a criminal case, right? Beyond a reasonable doubt in front of a jury, like the prosecution, there's depositions, they're parading witnesses around, there's DNA evidence and all that kind of stuff. None of that stuff is happening here. There is no beyond a reasonable doubt. It's your doctor saying, yeah, his depression could be because of his hearing loss, 50-50 chance. Tie goes to the veteran. You have the nexus, you have the diagnosis. Now let's talk about the symptoms. This is where the rating comes from. So it depends on your level of social and occupational impairment. I know it's weird when you're getting used to this. It's like, well, if I have multiple diagnosis or if I hook somatic symptom disorder and depression on to this, and this, won't I get a 70% depression rating 3 times? No. This is one of the things about the VA. You'll get one mental health rating. So you don't need multiple diagnoses. You just need to speak to your level of social and occupational impairment. This is what you're going up against in the C&P exam. Here's an example of the mental health DBQ. So you might as well have your doctor fill out this exact same DBQ, or some private doctors don't like doing this. It's fine. They'll fill out an independent medical opinion. If you can't get one of these done, contact my med team. They'll help you out. So what happens if you file this claim? You filed depression secondary to hearing loss, and they denied it. So what happens if you lose this claim? You filed depression secondary to hearing loss, and they push back on you. You can appeal it. Higher level review, supplemental claim. You have to read your decision letter and figure out why they denied you. And then one of your options is to appeal it and lawyer up. If that's the route you want to go, you might want to check out the sponsor of today's video, Hill & Ponton. Check them out at hillandponton.com. If you want to learn more about the VA disability claims process, check out my boot camp at combatcraig.com, links in the description. If you need medical evidence, if you can't get it, try my med team. Send an email right here. You might need to appeal your VA claim. If that's the case, you might want to check out the sponsor of today's video, Hill & Ponton. There's a link for them in the description. And also, if you were in Camp Lejeune between 1953 and 1987 for longer than 30 days, this is the Camp Lejeune water contamination lawsuit. Hill & Ponton might be able to help you out with that as well. Links in the description.